A lumbar or lumbosacral strain is an injury to the muscles of the lower back. It's really common and very frequently experienced by active duty military personnel, and many military veterans have long-lasting pain in their backs that ultimately leads to disability. In this video, I'll discuss a lumbar strain and why they're potentially so common in the military. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. A lumbar strain or a lumbosacral strain is an injury to the lower back, especially to the muscles of the lower back. An affected military veteran might experience sudden or more gradual lower back pain, and specifically pain and spasms in the muscles around the lower back. And if you kind of feel your lower back, very often these are the paraspinal muscles on either side of the midline of your lower back. Again, pain that you can localize to a small area there, or muscle spasms and guarding. Now, a physician can usually make the diagnosis of a lumbar strain through basically what's called history and physical exam. We ask you the story, how you got hurt. There's usually with the lumbar strain a very specific injury that happened, jumped out of a vehicle, fall, some kind of event where you were lifting something heavy and you felt a strain, something along that lines. And then they can diagnose it by physical exam. Typically, it helps to either see a spine specialist or an orthopedic surgeon, but even primary care doctors can make that diagnosis. Now, they'll get x-rays, sometimes get an MRI, and that can be helpful to rule out more specific problems, degenerative disc disease, facet osteoarthritis, herniated disc, any number of things. But sometimes that can all be negative because, again, muscles don't show up on x-rays. But yes, those studies can be helpful. Now, a number of physical activities have been associated with lumbar strains, and they're typically sports or very strenuous physical activity. And a specific injury to those areas can damage the tendons and muscles in your lower back. So you're thinking pushing and pulling activities like weightlifting or football can do it, or pushing, pulling activities in the military certainly can. Sports or jobs that require sudden twisting of the lower back can lead to injury, and obviously the military falls into that as well. Certain risk factors like, and these are more sort of how you're situated, but excessive lower back curvature, a forwardly tilted pelvis, weak abdominal muscles, tight hamstrings, all of that can increase the risk of injury, but you don't have to have any of those predisposing factors to suffer one of these acute events. They're very, very common among members of the military and military veterans. There was a study that looked at an Army database of all hospital admissions for active duty Army personnel over 6 years. It was used to assess injuries resulting from Army physical training. And this was both men and women. And that physical training in the Army was the leading cause of these lumbosacral strains, lumbar and sacral spines. The Army physical training injuries were found to account for a huge amount of lost duty time and impact the readiness and military readiness. Another study looking at sort of previous research confirmed that musculoskeletal disorders were a huge source, and again, specifically lumbar strains, huge source of outpatient visits to doctors, lost work time, hospitalization, and disability in the military. And back disorders were a huge percentage of those musculoskeletal injuries that led to those visits, hospitalizations, and missed time in the military. They analyzed over 41,000 military disability cases, and what they found is those lumbar strains and also intervertebral disc syndrome were the most prevalent diagnoses for back disability among the military. If you have ideas for topics for future videos for this channel, risk factors for injuries, particulars about DBQs or Nexus letters, really anything, leave those in the comments below. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested yourself in a Nexus letter for your injury or condition, click the link in the description below and you can learn more about working with me and working with my team. We do everything we can to make the process simple, to make it quick for you, and I really try to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you much more.